Sage Zari on Telehealth Innovation in Behavioral Health. By Dennis Relojo-Howell. Behavioral health has undergone a technological shift in recent years, with telehealth emerging as a fundamental transformation in how mental health services are delivered. The industry continues to evolve, and many therapists and behavioral health clinicians find themselves at a crossroads to find additional means of communications or risk being left behind. I met with Sage Zari, CEO and digital strategist with extensive experience in the behavioral health technology sector, to discuss why innovation in telehealth isn't just an option for modern therapists, it's a must-have modality for patients and clinicians. In this conversation, Sage shares insights on overcoming resistance to digital transformation, building effective telehealth practices, and the future of behavioral health delivery. The shift to telehealth communications. You have been at the forefront of behavioral health technology as a CEO in this space. What's driving the urgent need for therapists to embrace telehealth communications? This initiated during COVID with all of the lockdowns. People lost their jobs and sense of purpose, and they needed access to affordable mental health from the safety of their homes. In addition, there are generational changes. For example, Gen Z is far more familiar and comfortable with smart devices, as over 95% have a smartphone, laptop, or desktop. So consumer expectations have shifted, and therefore traditional therapy settings are less appealing to younger generations of people needing mental health support. This is leading to a massive access crisis, as over 160 million Americans live in areas with mental health professional shortages. And finally, people expect the same convenience and accessibility in healthcare that they get from other services. In addition to mental health access, the deeper issue is that the traditional once-per-week, in-office model was designed for a different era. Today's clients deal with anxiety, depression, and behavioral challenges that don't operate on a weekly schedule. They need support when they're having a panic attack at 11 p.m. or when they're struggling with addiction cravings on a weekend. Telehealth and digital tools allow us to meet people where they are, when they need support. As a CEO in this space, I've seen firsthand how technology can bridge the gap between episodic care and continuous support. The clinicians that embrace these tools are not just adapting to change, they are providing better outcomes for their clients when they need them. Clinical outcomes. Many therapists express concerns about the effectiveness of telehealth when comparing them to in-person sessions. How do you address these concerns? These concerns are rooted in valid anecdotal experiences as well as some strong empirical literature to earlier telehealth platforms. But there are a few things to keep in mind. There have been a lot of advancement since the early days when many of these oppositional studies were initiated. The technology wasn't reliable, and many therapists were forced into digital delivery without proper training or support. Secondly, offering virtual visits is not therapy, and is not intended to be an exclusive modality for communication. It is merely a supplementary tool that will get patients further participation. With that in mind, more recent research is now overwhelmingly in favor of telehealth's effectiveness. These studies show that outcomes for depression, anxiety, PTSD, and substance abuse treatment are comparable to in-person care when delivered via quality telehealth platforms. In some cases, particularly for clients with social anxiety or those in rural areas, outcomes are actually better. Effective telehealth requires more than just putting a traditional session on a video call. It will require intentional adaptation of therapeutic techniques, as well as understanding the digital body language and integration of digital tools that can enhance the therapeutic process. When done properly, telehealth can actually provide more touchpoints with clients, better data on their progress, and tools for real-time intervention. What are the biggest barriers preventing therapists from successfully implementing telehealth services, and how can they overcome them? There are three main barriers: technological, regulatory, and psychological. Technologically, many therapists feel overwhelmed by the options and worried about making the wrong choice. The solution is to make sure you choose a HIPAA-compliant platform with good support, and to ensure reliable internet and invest in quality audio-visual equipment. You don't need to be a tech expert, but you do need to commit to learning the basics. Regulatory barriers are real but often overestimated. Yes, there are licensing requirements and insurance considerations, but these are easily navigable with proper guidance and a good provider. I always recommend that therapists work with consultants who specialize in telehealth compliance or join professional organizations that provide clear guidance. The psychological barriers are often the most challenging. Many therapists worry about losing the intimacy outside of an in-person connection or feel like they're not providing real therapy. Both the clinician and patient needs to accept this as nothing more than an additional tool. Once this mindset shift occurs, they realize that the digital delivery of mental health services will still remain a therapeutic relationship. Business outcomes. From a business perspective, how does telehealth adoption impact a therapist's practice sustainability and growth potential? Telehealth is fundamentally a business transformation tool and not just a clinical one. From a sustainability perspective, it addresses several critical challenges facing a therapist's private practice, including geographic limitations, scheduling inflexibility, and overhead costs. Geographically, telehealth allows therapists to serve clients beyond their immediate area, which is incredibly valuable for those with a highly specialized expertise. A therapist specializing in eating disorders can now work with clients nationwide, dramatically expanding their potential client base, including those in rural areas. Scheduling becomes more flexible for both the therapist and client. No-show rates dramatically decrease with telehealth because clients don't have to account for travel time, parking, and other logistical issues associated with on-site. This results in more consistent revenue and better utilization of time for both clinician and patient. Overhead costs can be significantly reduced too. Therapists can work from home, reduce office space requirements, or share office space more efficiently. This leads to significant savings, resulting in a 30 to 40% increase in profit margins. From a growth perspective, digital tools enable therapists to scale their reach beyond the traditional one-to-one model because they can offer group sessions, digital courses, or hybrid models that combine individual therapy as well as digital resources. This creates multiple revenue streams and allows therapists to serve more people without proportionally increasing the time they have to invest. The future of behavioral health communications. Looking ahead, what do you see as the most significant opportunities and challenges for behavioral health innovation in the next 5 to 10 years? The biggest opportunity is the potential for more personalized, data-driven treatment. We are moving toward a future where therapists will have access to real-time biometric data, behavioral patterns, and environmental factors that can inform treatment decisions. Being able to predict a client's depressive episodes based on their sleep patterns, social media activity, and phone usage, and then offer an intervention will lead to more proactive treatments. We're also seeing exciting developments in virtual reality therapy, which can create controlled environments for exposure therapy, social skills training, or trauma processing. The possibilities for treating phobias, PTSD, and social anxiety are particularly promising. Privacy and data security concerns are still a major issue, so we have a lot of work to do. Therapists will need to become more sophisticated about data protection and client consent. Regulatory frameworks will need to evolve rapidly to keep pace with the innovation while ensuring the client's safety. The current patchwork of state licensing requirements for telehealth is already limiting access and will become even more problematic as treatment becomes more digital and cross-jurisdictional lines. Finally, we'll need to address the training and workforce development challenges. The therapists of the future will need to have training to these technological and data advancements. Our educational systems and continuing education programs need to evolve to prepare practitioners for this reality. Any final thoughts for behavioral health professionals who are considering their role in this digital transformation? The transformation is happening whether we participate or not. The question isn't whether the field will become more digital, it's more about how current practitioners will be part of shaping that future. And to be clear, embracing innovation doesn't mean abandoning the core values and principles that drew you to this field. Technology should enhance clinicians' ability to provide compassionate, effective care, not just to replace it. The most successful behavioral health professionals I work with are those who see themselves as lifelong learners. They're curious about new tools, willing to experiment, and committed to using technology in service of better client outcomes. Most importantly, remember that clinicians are not just adapting to change, they are helping to create the future of mental health care. The decisions they make about technology adoption, the innovations you embrace or reject, and the way they integrate digital tools into their practice will influence the direction of our entire field. The clients who need their help are already living in a digital world. So it is best to meet them there with the same expertise, compassion, and commitment to healing that has always defined this noble profession. Technology is just the vehicle, the destination remains the same.